Hello everyone. Can you all hear me?
Hello.
Hello, and this is going to be an interactive
Yes.
session, so I request all of you to please switch on your camera and please be in a comfortable place where you can chit chat with me. We are still adding people, so we'll wait for 2 more minutes before we can begin. Come.
Yeah.
I think 1 or 2 people are joining.
Okay.
Okay.
So who all are here? Okay, Dr. Ishita, Dr. Shweta, Dr. Nita, Dr. Akanksha, Dr. Anjali, Dr. Rakhi. Okay. Dr. Mahima. Okay, is that all? Anyone
Two more
missing?
to come.
2 more to come, okay.
To join.
Yeah. I think let's all of us mute our mics. I will let it be an open mic session, but in some time while everyone is joining in, it becomes too much. So just for now, just mute yourself. Thank you so much.
Okay, I think we can start now.
I think so.
Dr. Anil
All
is
right.
remaining.
Doctor?
Anil,
I'm not sure. I'll have to
Dr.
check the
Anil.
group. I'm sorry, I've not had the chance to look at the group today. Dr. Anil Patel, yeah, he's. Is Dr. Anil Patel here? No. Alright. Okay. Alright, we'll just start. Hi everyone. I'm Jay. I'm sure you all know Dr. Sapna, right?
Guys, can I have you all on screen? That would
Yeah,
be great.
all cameras on.
It is an interactive session. Please switch on your
Yeah,
cameras.
please switch on your
So that
cameras.
we can see each other.
Right.
So that I know all of you before you come
Hi,
here.
Dr. Shweta. Hi, Dr. Nita. Dr. Anjali. Dr. Rakhi. Hi. Dr. Akanksha, Mahima, and Chamandeep. Can I please have your cameras if you don't mind? Yeah. Hi, Dr. Mahima. And one more has joined, is it?
No. Dr. Anil is remaining. Still
Right,
remaining.
still,
Okay,
alright.
we can start.
Hi, Dr. Ishita.
Okay, how are you guys doing? How are you girls doing? All
Oh
good?
yeah, it's all girls, right? No, there's only Dr. Anil who's missing, but presently it's all girls. Hi, Dr. Chamandeep. How are you? Yeah, it's fine.
Okay, you all can switch on just in case you don't have any noise around you. You can keep your cameras voices
Yeah, if
on.
you're in a noisy situation, please keep your mics
or else
mute.
you can keep your mics on. Okay, so you guys already know me. I'll introduce you to Jay. Jay is CEO of Stellar Aesthetics, and all your business session, all your marketing session are going to be taken by him and his team. So today what we have planned is we have planned an interactive session with all of you, because you all are coming from different areas of the country, and you all want to set up your practice in your particular area. So we would want to understand your viewpoint as of now about cosmetology. What do you think cosmetology is? What are your plans? What all are your expectations? We want to understand everything,
Yeah,
so that we can take you ahead from there.
Yeah, and I want to, like, this is me, and I like to personally, I'm going to be talking a lot about revenue and money. Okay, so I know that you as doctors don't like talking about money, even to your own patients. I understand that, and that's something I'm hoping to change during the course of our program. is that it should be very comfortable for all of you to talk about money, because cosmetology, unlike other medical fields, is a money practice. It is a practice in which you are going to be talking a lot about money, and it's going to be one of your primary concerns as well when it comes to the products that you're going to be using, what kind of patients you're going to be pulling in, what kind of patients you're going to be dealing with. All of that is going to be very tied into the revenue and the money that is going to be coming in and going out. So we all have to get a little comfortable talking about money. All right. So I would want to know each one's money targets as well, right? We all have it, right? We want कि इतना तो कमाना चाहिए, we at least इतना तो पैसा घर में आना चाहिए, तब जाके कुछ अच्छा होगा, it'll be good for me, right? Everybody, I know that usually doctors don't like talking about this, especially in a public forum, but really this is a private group. It's not going to go out from here, but I still would want you to be very comfortable talking about that. And in fact, if you've not thought about it, especially those just fresh out of college, I think we have one or two people who are just fresh out of college as well. Yeah, so especially them, I do want them as well to think about the kind of money that you would want to earn in your life on a monthly basis or on a yearly basis, whatever works for you. I would want to know that. Okay, as a part of this present day conversation, those numbers and figures will change, and they should change. They should change. वो change भी होने चाहिए. As we learn more, as we get into it a little bit more. But still, at present, आज इस moment में, what is the revenue target या money target that each one of you has in their own lives? I would want to know that as well, because that's going to help me set the goal for me as to what am I supposed to deliver to you guys, right? That will also help me do that, right? So we'll just begin with the introductions from where how is it on my screen. Okay, so the first doctor that I can see is Anjali Toshniwal. So Dr. Anjali, can I have your camera and your mic on, please? Yeah.
Hello.
Hi, Dr. Anjali, how are you?
I'm great.
How's Mumbai treating you?
Yeah. So far good.
So far good. All right. Mumbai is a good city. All right. So it's a fun city to be in. A little hard, but it's fun. All right. So Dr. Anjali, first of all, just for the sake of the group and everyone, can you just introduce yourself? Tell us a little bit about you, where you come from, what are your plans, what do you want to do, and why you want to get into cosmetology and all of that.
Okay. I'm a recent BDS graduate. I'm from Vidarbha, Nagpur side, if you must be knowing Akola.
Right.
And since it's a hometown, it's a very small town. So there people are not well aware of this field actually, till date. So I'm here to get to know about this whole new dimension of cosmetology, and to get the exposure of that, because I have no clue about it.
Right. Is that really why you want to get into cosmetology? Because
No.
why is it that you want to get into cosmetology?
The reason is because I always wanted to have aesthetic practice in my clinic. At first when I thought that I should have my own clinic, at that time I had this in mind that okay, I want to have a total aesthetic practice done. But till then I had only the idea of the dental aesthetics, always.
Right.
But then there was this one session in our college in which they introduced a bit of facial aesthetic part of cosmetology.
Right.
And that's when I got to know about this thing. But yet, since in small towns there is no so much knowledge given about this.
Exposure.
So I was not fully aware. Till date also, I just know the YouTube videos and stuff. I've learned from it. Nothing. There's no book of it or written something properly well guided.
Right.
Yeah.
So where do you plan see yourself in future? What place? Do you see yourself in Akola? You see yourself in some other city? Tell us a bit about it.
Yeah, I see myself in Bombay itself.
Okay.
So at first I thought that I'd be, getting a clinic here and stuff. But then again, it is not that easy as it seems to be.
Right.
Since Bombay is of course the hub, and there are many people, of course, here like before me. There are many people who have already, their practice there. So like I basically my first thought to it right now, as of now, is that maybe I want to start with consultancies for a few years, and then maybe like after 4 to 5 years, I guess maybe I can think of opening my own setup.
Right.
But till then, I have like I don't have confidence to put my own clinic, and I don't think that I would be able to do it. Maybe.
Right. Okay.
Okay.
Yeah.
So what I understand is you are recently passed out,
Yeah.
moved out of Akola, now in Mumbai, want to establish in Mumbai, and in few years you want to have your own clinic, right?
Yeah.
I mean, if possible, right now though.
Yeah.
I mean, if possible.
Got it, got it.
Yeah.
Okay. And you don't know much about cosmetology, only what you have heard.
Yeah.
Okay. Any money targets that you have? कितना पैसा enough है? I know that world is not enough, but फिर भी.
Like being a recent BDS pass out, I did not have that much idea of it. But the first thought what I had in mind was ki at least minimum I should be earning like 2 lakh per month. Like that was what I thought. Like I do not know about the prices, the cost of different treatments. I have no clue about it.
Right.
So this is what I thought, that okay, I should be earning this. Like of course not in the start, I won't get it in the start, but a decent like overall.
अगर dental practice डालते तो like मतलब कितना expectation होता if it would have been a dental practice? How many dentists over here can I have just by a raise of hand? 1, 2, 3, 4. Okay, 5. 5 dentists. Wow. All dentists or MDSs? MDSs. All MDSs. Okay, great. Okay. All right. So. Sorry, there are quite a few MDSs. Yes, there are quite a few MDSs. All right. So and आप सबकी private practice होगी, especially the senior doctors over here. You might have a private practice or some kind. If you do have a private practice, 2 लाख रुपए monthly earn करने में कितना time जाता है? How much time do you have to spend? How many years, months you have to spend from the beginning, शुरुआत में, to be able to earn regularly 2 lakhs a month? I want to know. Dr. Shweta, if you don't mind telling me. You're muted.
Hello everyone. Yeah, I think it takes almost 1 to 2 years, 2 years at least.
Right. Okay. I usually, especially for the dentist, I usually say कि अच्छा RCT किया है सबने, right? सबने RCTs किए हैं, right? Okay. How much do you charge for an RCT?
I charge 6,000.
6,000. Okay. To earn 2 lakhs, how many patients do you have to do if you were just doing RCTs? I mean, since that's the basic bread and butter of dentists, as it's always called, right? So what is the like how many patients will you have to do? 5,000 average रखते हैं तो mathematics easy हो जाएगा. Right? So
At least 400, 500 people.
I think 5 के हिसाब
40,
से
50.
yeah, about like
With an average
yeah,
of 5.
10, 20, 40 patients. About 40 patients. You'll have to do about 40 patients a month to be able to earn 2 lakhs a month. Okay, and that is pre-expense. Okay, that is like आपका जगह का rent, EMIs for your chair or whatever that might be. वो सारी चीज अलग हैं. Electricity costs, cost of staff, all that stuff, material and all that, right? So that takes about, and वो वहाँ तक भी पहुँचने के लिए 1-2 साल लग जाते हैं, if I understand Dr. Shweta correctly, right? So
Yeah.
Okay, good to know, Dr. Anjali. Good to know.
Okay, moving on to Dr. Shweta
Dr.
next.
Shweta next, because that's the next
Please
one.
introduce yourself. Tell us about you.
Okay, my name is Dr. Shweta Tekniwal. Right now I'm practicing in Ranchi, Jharkhand, and I'm MD's endodontist. So for 4 years I was in government setup. Here it's Rajendra Institute of Medical Sciences.
Right.
But now I'm into my private practice since 2 years. So now I want to practice cosmetics just because I'm seeing my colleagues doing cosmetic treatments
I get it.
online. So I'm excited about it. Just that's it. I don't have much idea about it.
So you
But
have your
yeah.
private practice now set, which is for
Yeah.
like 3-4 years? How long has it
Uh,
been that you have your clinic?
I have my clinic since 7 years.
7
Actually, me
years.
and my husband both are endodontists.
Right.
So when I was in government setup, he was looking after the clinic. So
Right.
So you
it's
have a
been
practice for
7, 8
7 years
years.
now.
Yeah.
Okay.
Okay.
Any
Great.
idea about the kind of crowd in your town, the kind of
Oh, Ranchi is a great city.
no, not that wise, the cosmetology wise.
Right.
You have any idea about the market over there?
Yeah, actually, not many people are practicing cosmetology here.
Right.
I think 3, 4 people only, and that too, they're not very famous. Like people doesn't know about them.
Yeah, people don't
Right.
know about them. That's true.
Uh,
And we're gonna
yeah,
change. We're gonna change that a little bit. After this
yeah,
session, we're gonna be changing that a little bit. Great.
yeah.
Awesome.
So I think I have a scope.
Absolutely.
And
Absolutely.
what all do you know in cosmetology? Anything?
Yeah,
कुछ सुना होगा.
I know some PRPs, PRFs, and uh, injections, Botox,
Right.
threads,
Okay. Okay.
Okay.
And what are your
then
revenue targets, Dr. Shweta? क्या मतलब क्या सोचते हो कितना कमाना चाहिए? Like how much do you want to make?
at least 2, 3 lakhs
2-3
per
lakhs a
month.
month. Okay.
Okay.
Wow, Anjali who's just starting out, and I mean this is a nice thing to see, right? Anjali who's just starting out wants to earn about 2 lakhs a month, and Dr. Shweta who's been practicing for 7 years also wants to earn about 2-3 lakhs, averaging about the same amount.
Like
That's
in
nice
the
to see.
beginning, I think Rachi and
Right. Okay. I hope to change your mind though. About what do you think about Ranchi? It's Ranchi is a lovely city. Actually, I have a few relatives from there, so I have one of my cousins' wife is from Ranchi, so I'm aware of the city. I've been there. Yeah, so it's a lovely city, and actually the market is great there. I mean, it's an untapped market. Yes, it's an untapped market mostly, but वहाँ के लोग करवाते हैं बाहर जाके करवाते हैं.
yeah.
वो वाली बात
But
है.
but I've talked to many people. They are like it will be having some side effects, or matlab they are like tentative about these
Right,
treatments.
right.
So first, I'll have to make them aware that these are safe treatments, and
Absolutely,
you know,
absolutely. Yes, थोड़ा education तो लगेगा ही. Since it's a fairly emerging field, it's an emerging field, so definitely education of the population will be required. But it's not that difficult as you think. It's not that difficult to educate. सब लोग आज social media पे हैं, you know. So it's in fact the smaller the town, the more people are on social media. It's like that.
and the most challenging part on my side is one dermat is practicing like beside my clinic, or only he is practicing this.
You don't
That's
have to
fine.
worry about
That dermat हो या कोई plastic हो, anybody,
कोई भी हो,
it doesn't
you don't
matter.
have to worry about.
Yeah, as long as and I always say this, कि as long as the product is good, as in what your services you're offering is the product, right? As long as your product is good, competition is in fact good for you. Competition helps your business. So yeah, so I don't consider that as a challenge. Yes, that's a good thing to know. It's a good to know, but it's not a challenge. I don't consider that as a challenge.
Let's hope for the best.
Yeah, let's hope for the best. Absolutely, absolutely. The next is Dr. Akanksha
Akanksha.
Kukreja. Yeah, Dr. Akanksha. You're muted. You're muted, doc. You're muted.
Just a second.
You'll have
Just
to
a
unmute
second. I'll
yourself.
do it from my end.
I don't think you can.
Yes.
Yeah,
Yes.
sorry.
Please.
Sorry for the inconvenience.
No problem.
Myself, Dr. Akanksha Kukreja. I recently passed out in oral and maxillofacial surgeon (MDS).
Great.
So, basically, it was my personal interest to do cosmetology, and that's why I came here.
Great.
Where are you from, Akanksha?
Gandhiram, Gujarat.
Okay, so you're based in Gujarat?
Yes,
Okay.
actually, I got married in Gujarat.
Okay.
Okay, great. And what is your practice like? Are you currently practicing anywhere,
no.
or no? You just fresh out of this thing. Okay, great.
Yes, yes.
Great place to be. And what are your plans? Are you planning to set up your private practice, or how's it?
Definitely. My husband is ENT onco surgeon. We had the
Great.
hospital. Even my father-in-law is also onco. They practice onco surgery. So
Great.
basically, I want to set up in one floor my cosmetology and oral surgery department.
Okay.
So I thought before starting, I should go through it all this.
Are you looking to do the onco patients reconstructive
Yeah,
for
I
them?
do. Reconstruction. I just help out with my. I just learn with my husband.
Right.
Not much.
And what
Because
about?
recently I passed out, and during my PT I used to assist
Right.
my
Right. What are your plans? As in, what are you looking for in the future? How you want to incorporate this? I want to know, since I'm sure you've thought about it.
Basically, I'm not that interested in oncology, so I want to practice in trauma and this cosmetology.
Right. Right. Wow, very varied fields, trauma and cosmetology, by the way. Okay, what are your revenue targets? What are your money targets? What do they look like?
At being a PG in OMFS, I think at least 6 to 7 lakh or minimum 5 to 6 lakhs a month I should earn.
Okay.
This is what I initially.
And you're in Gandhinagar, right? You said, right?
Gandhidham.
Gandhi.
Nagar is different and Gandhidham is different.
Gandhigram is different. Okay. Gandhigram is. Can you tell me a little bit about? Can you tell me a little bit about Gandhidham? A little bit how what's the look like?
Frankly speaking, even I have not been there for long. After
Okay.
PG, I came to Mumbai for implantology and cosmetology, so I don't have that much idea. But yeah, I have seen that 4 to 5 dermat is there who is practicing cosmetology.
Okay. Okay. And वैसे भी Gujarat is a good market. I mean, Gujarat, the people out there have the money as well. They have the mentality as well for it. So that way, Gujarat in general is a very good market for cosmetology.
What all do you know about cosmetology, Akansha? What all do you know till now?
Frankly speaking, whatever we have learned during our PG, that much
Which
I
is
know,
not much.
more than that.
Which is not much, a little bit, I guess. In few
Yeah,
colleges
exactly,
they cover
exactly. And clinical is basically zero.
it zero.
Only
Right.
theoretical we know.
Right.
Okay.
Okay. Any challenges that you think you might have or you might face in setting up your practice?
No, I don't think so. For that, I have to go in that field first. Then only I came to know.
Right, right. No, I mean just कुछ मतलब हो ना कि भाई यार शुरुआत में how will I do this or how will I do that? Do you have something like that so that I can then try and figure out if I can help you there?
Basically, first of all, I would like to learn about clinic, how to set up the clinic, what
Right.
instruments should be there.
Right.
As our hospital is, we are planning for a new hospital. It is almost done. Only for my cosmetology section, it is on with help basically.
Okay.
So after this, I will plan accordingly. That how should I plan for it? What instruments is required?
Right.
The clip designs and all.
Right. Of
Because
course.
dental and cosmetology is totally different. So according to that, we have to design the clinic.
Definitely, definitely.
Being a
Absolutely.
dentist, we cannot go in such design.
Yes, absolutely. And I'm glad that you know that. A lot of people coming from a dental background do not know that. Surprisingly, they do not know that. I'm glad that you do that. You know, ki dental and cosmetic is quite different, poles apart that way.
As it is aesthetic clinic, it should have a good aesthetic.
Right, exactly, exactly. Which also brings me to the point, and I will have a longer discussion with you, Dr. Kokreja, because usually I don't recommend cosmetic clinics with hospitals. They don't go together.
Okay.
Yeah, they don't go together because the patients, I mean, the customers in cosmetology don't want to go to a place which is sort of, see, hospitals are a depressing place, right? I mean, especially onco and all of that usually, so it doesn't sort of match. If your salon is next to a onco surgeon's clinic, you would probably not go there, so it's like that. So I will be having a longer conversation with you in person and in private as well, so that I can get to understand what it is that you guys are planning and how you're planning to go about it, and how we can sort of make sure that part of the practice does not affect your cosmetology practice negatively. So that's something that I would want to talk to you about as well. All right. Dr. Nitha Fasli is who I can see next.
Hi,
Hi. Can I just say one thing though? Do you know Nida Fazli?
Nida Fasli.
Yeah. But do you know Nida Fazli? Have you heard of her?
No.
She's like a very, very, very big ghazal singer. So Nida Fazli is like god level ghazal singer. So when I hear your name, I remember Nida Fazli all the time. Nida, so it's like that. Anyway, please carry on, doc. Please tell me a little bit about you.
Okay, I'm from Kerala
Okay.
and I'm a PDS graduate and I'm just practicing in my husband clinic. My husband also owns a clinic, dental clinic. So actually we are planning to start like introduce our aesthetic part also in that clinic
Right.
next month.
Right.
So I was very interested to learn facial aesthetics like 2 years ago itself. Like I was planning to do,
Right.
but I'm not sure I can do it or not. Like a BDS graduate can do it or not. I don't know. I'm not sure. So
Right. You can definitely do this. I mean, the from a legal standpoint, everyone because see out here we are not doing surgical cosmetology at all. These are all minimally invasive or non-invasive. Dr. Sapna would be much more ideal to guide you in sort of what kind of procedures and how we are going to get into that. But from a legal standpoint alone is what I'm talking about, is that you can definitely practice cosmetology really well.
Which city are you based, Nita?
I'm from Kerala.
Kerala. Okay.
Yeah.
And you said you recently passed out.
Yeah, like in 2023.
2023 itself. Okay. What all do you know about cosmetology?
Yeah, I have heard about microblading, microneedling, PRP, GFC, then Botox.
So a little bit
and-
here and there you have heard about it.
Yeah.
And
yeah.
what makes you come into cosmetology?
Like I was very interested to learn like 2 years ago itself. Yeah. Then I was searching for courses also to do after my internship. So yeah.
Right.
Okay.
Mm. What are your revenue targets? What does money look like to you? And a little bit about that.
Like I'm not sure. I am very new to this field, so I think 1,50,000 to 2 lakh per month initially. I think so.
Okay, all right. And can I know, since are you like you already have a clinic, right? And are you planning to
Yeah.
open another one, or are you planning to open it in the same
No,
place?
adjacent to with that itself, we are planning to start that aesthetic clinic.
Okay.
We are planning to do it in next month.
That's
Okay.
good. That's great.
That's great, actually. Great timing.
That's a good start.
Yeah, it's great timing actually. So that's perfect timing actually, because then you get to implement what you learn over here immediately into your practice, which is what always I would recommend from a business standpoint, and I think from a clinical standpoint as well.
So tell me, Nita, what is the city like? The city where you're planning to live in Kerala, the city where you live. Which city is
It's
that? It's a
a,
tier 1 city, tier 2, tier 3?
I don't know. I mean, people are coming and asking about this like cosmetology, treatment and all, like microblading, liquidation, and people are asking. So that time we thought, okay, we'll start this clinic
Right.
soon. Yeah.
Okay.
So I
Good.
think
Okay. Any challenges that you can foresee, maybe that you might face while getting into the aesthetic practice?
yeah, I think people are not aware about this all these procedures and all, like Botox, filler. Like in our city, I think so. And I don't know, like they come to us also, like a biggest graduate, they will come to us also. I'm not sure. So that's a concern for us. Like we'll see.
Right. Any other concerns, any other challenges that you can foresee apart from patient information or patient knowledge? Apart from that, do you see any other challenges as well?
This is the main concern I have.
Okay.
Like, yeah.
Okay.
Good to know.
Dr. Rakhi.
Hello, I'm Dr. Rakhi. I'm from Kerala. My city is Trivandrum, capital city, Kerala.
Great.
So I passed out in oral maxillofacial surgery 2 years back, and afterwards I practiced like freelance for a couple of months.
Mhm.
Then I thought, yeah, I should do cosmetology, this thing. Then I joined one hair transplantation clinic. So I've been doing hair transplantation for the past 2 years.
Great.
And then again I know about PRP, this GFC thing. Then thread therapy, we don't use it for the face, but for the for hair growth.
Does
That
it
much
work?
I know.
Does that work?
Yeah, I'm not sure. Like the results are like not that good. I'm not like, I don't recommend.
Okay.
So I've been doing this thing. Then I thought, yeah, I should have this fellowship with me. So even if I'm a practicing maxillofacial surgeon, what if the patient asks me, do you have a certificate in this thing? So I want to show them. Plus the like people nowadays, I think in Trivandrum they are intrigued about all these things and they are asking about it.
Right.
So I think maybe in the future, maybe like this thing will
Not in future, it's already there.
It's already there.
Yeah,
Big,
it's
big
there.
time.
Especially in
But when
South,
compared
a lot.
Big time.
But when compared with Kochi, like Ernakulam, other cities, some of the cities there, people, most of them are like field based. So they wanted to maintain that aesthetic. Trivandrum, most of the people are like government employees, so they are not that much concerned about these things. But it's changing, I feel.
Yeah.
So hair transplantation we are getting a lot,
Right.
but these things are few once in a while we are getting. So I want to learn that and I want to seize that opportunity if I'm getting any. So that's why I
Absolutely.
So do
joined.
you want to open your own practice or you want to continue working there and get into cosmetology? So because you have a place where you're working currently.
Yeah, what I'm like, I have one more year of bond. So
Okay.
what I'm thinking is maybe like they do have a couple of sports in Ernakulam, like the other city for doing this thing. They have derma and everything inside. So maybe if I put a business proposal, something like that, they might ask me to come and do it there.
Good.
They have given me leave for this thing.
Okay.
Specifically, straight away they gave me. I
Right.
think maybe
Great.
that idea is there with them. I'm not sure.
Right.
So currently I'm planning to work within this thing, maybe freelance a little bit because this doesn't comes within the bond.
Right.
So I'm purely I have bond for this hair transplantation. So maybe
Okay.
I can work outside also. And I don't know.
That's
Waiting
good.
to see how it will turn out for me. So
Right.
That's good, actually.
What about your revenue targets?
Yeah.
revenue, maybe 2. I don't know. Initially, I'm thinking like that. Like afterwards, money will come. I'm feeling. I don't know.
Right. Okay. Any challenges since you've been doing hair transplantation, so you've been seeing cosmetology up close and personal. So any challenges that you foresee for yourself getting into the practice?
So I don't know how many of the clinics are practicing this thing here in like a lot of them are there, but it's not that much booming. So that is one of the things that I feel about Trivandrum. If I'm shifting to Ernakulam, that is a different thing.
All right.
So that is the one thing. That patient flow is the one thing that I'm concerned about. Like once in a blue moon, if we are getting patients like that, then our practice we won't be good at it.
Right.
So that is also there. Patient flow. That is one of the things that I'm like concerned about.
Okay.
Nothing else.
Nothing else. Okay, that's great. That's good to know. Any other questions from her? No. Okay. Shall we move on?
Yes.
The next one. Thank you so much, Dr. Aki. Dr. Mahima is next on our screen.
Hello everyone, I'm Dr. Mahima and I'm from Jaipur, Rajasthan, and I've recently completed my MBS in oral and maxillofacial surgery.
Great. So Doctor, tell me a little bit more than that. I'm sure there is more to know about you than just that you've done oral and maxillofacial surgery recently.
Yeah, I met you both in conference, AMSI conference in Mangalore, and then I was introduced to this part of maxillofacial surgery because in colleges there's no
Not usually covered, yeah.
Yes, ma'am. Then you guided that within college it won't be much exposure to this, and I should go for it if I'm interested. I had a detailed discussion with you both, and then ma'am you told me that I should go for this thing after my PG if I'm interested, because in college in 3 years there was nothing about cosmetology. It was all about trauma, onco, and other things. So I've been following you since 3 years, and I wanted to do this program from you only. So
Thank you so much. It means a lot to me, Mahima. And so tell me, do you want to settle down in Jaipur itself?
yes, ma'am, I've been married in Jaipur itself.
Okay, you're married there. So what does your husband do?
Ma'am, he's a businessman.
He's a businessman. Okay. So you're planning to set up your practice, you're planning to start with consultations. What do you see? What do you see yourself doing in the near future?
I think for some time till I gain so much confidence that I can handle it single-handedly, then maybe I'll go for private practice. But I think in starting I'll join some clinic.
Okay. And what do you think your revenue targets are? What does it look like?
Ma'am, in Jaipur it's still a new concept.
No, no, Jaipur it's huge. Come on.
Now people are still adapting to it because dermats and plastic surgeons, they are dominating this field. So for as being a maxillofacial surgeon, people hesitate because people
I
want.
have a student from Jaipur. Dr. Manish is from Jaipur only. He's a
Dr. Manish.
maxillofacial senior surgeon, quite senior. He has learned cosmetology with us, and he's doing international patients as well in Jaipur. So the market is big. It's a touristy place, lot of people coming in. So don't think that the market doesn't exist. Just think what you want. If you want a private practice, tell us that, and we'll guide you towards in that direction.
Yes, ma'am, I want.
Okay, so market is there, and it's a very
You're in a great place.
you're in a great place. Everyone, all of you actually. India
Yeah.
itself is a great
India
place.
is a great
And the
market.
cosmetology industry has just begun.
Yeah.
So it's a very booming industry for all of you, be it tier 1, tier 2. Of course, the kind of crowd is going to be different. The person, the doctor sitting in tier 1 might get a different kind of patient compared to someone sitting in tier 3. But the patients are there. The mindset is open to look good. Everyone wants to look good. Okay, so just think what you want, and I'm sure you'll land up there.
Okay. I wanted to also understand what challenges do you foresee? Just like I'm asking everyone, I would want to know your perspective on the challenges that you might face according to you.
सर सो फार मतलब जैसे भी डिस्कशंस लोगों के साथ में पेशेंट्स के साथ में हुआ है तो इट्स लाइक कि आप तो डेंटिस्ट है ये सब काम तो इट्स लाइक डर्मैट्स या फिर प्लास्टिक सर्जन्स मेनली प्लास्टिक सर्जन्स का है तो इट्स लाइक अभी ये थिंकिंग इट नीड्स टू चेंज विद टाइम तो मे बी
मतलब are you talking to doctor? Are you talking about doctors telling you this or patients telling you this?
पेशेंट्स टेलिंग दिस
Okay. Okay. That and I would want to know a little bit more about that conversation. Not in this setting, but I would want to know a little bit about the conversation that you must have had, because it seems ये conversation it's not a normal conversation to for a patient to have with their doctor कि अरे आप तो dentist हो आप क्यों कर रहे हो. That is something that I think बहुत rarely मैंने सुना है ऐसा कुछ होते हुए. So I would want to know a little bit more about those conversations later on. जब हमारे we will have private conversations as well. I will be having with all of you guys. So at that time I would want to know a little bit more about that. So great to meet you, Dr. Mahima, again. I'm so sorry I do not remember you. It's been a while since the Mangalore conference.
It's been 3 years.
Yeah, so it's been a while.
But I'm glad you remember us.
Yeah.
We are very glad.
Yeah.
And
Thank
it's
you
a
so
pleasure
much.
to have you
Thank
here.
so much. Yeah, it's a pleasure to have you here.
Ma'am, sir, we met again in Coimbatore. We have
Okay.
met twice.
Coimbatore Midcoms.
Yes, ma'am.
Okay.
Good. I'll remember now.
Yes, ma'am.
All right.
Dr. Chamandi.
Dr. Chamandi.
How are you doing? Are you there?
Yeah, I'm there. Hello.
Yes, we cannot see
I'm
you.
fine.
Can you switch on the camera?
Yes.
Yeah, great.
Yeah.
Hi, Dr. Chamandi. How are you?
Hello. I'm fine, doing well.
Good.
Started practicing back again.
Good.
Back to work.
Awesome.
And we are looking forward to have you here. So tell us, everyone, a little bit about yourself.
Yeah, what do you do and same thing, revenue targets. I want to know revenue targets at the end.
Myself, Dr. Chamandeep. I did my post-graduation in OMFS, practicing since 2 years at hospital, Bhandari Hospital and Disha Hospital. Now we are planning to open one more
City,
clinic.
Dr. Chamandeep,
A
city.
private clinic.
Which city?
From Jabalpur.
Right.
Okay. Madhya Pradesh.
So we are planning to open one more clinic, and later on, when it's going well, then we are planning to extend it as well in other cities as well.
Great. Great. That's good to know. can you tell me a little bit about how long you've been practicing? You said
2 years.
2 years. 2 years. Okay. And what are your revenue targets like? What do they look like?
Initially, I think to start with this aesthetics, 8 to 10 lakhs per month.
To start with. Oh wow,
Good.
big target, man. Okay, good to know, man. Good to know. Um, I'll try my best to help you out with that. I'll try my best.
Mhm.
Any challenges that you foresee?
It's a 3-tier city here in Jabalpur and कुछ ज़्यादा यहाँ पे है नहीं जो लोग प्रैक्टिस करते हैं डरमैट्स ही हैं ज़्यादा
Mm-hmm.
so and they are also very less
Right.
people basically go to Indore or to Bhopal for these
Right.
kind of treatments.
Right.
So do you want to begin with Jabalpur itself, or you want to begin with Indore or some other place? What is on your mind?
Currently we are planning to start from Jabalpur only, then once it is settled here then we would like to extend it.
Okay. And what else I was asking was, what all do you know about cosmetology? Are you aware of anything? Have you seen anything? Done anything?
I did this course in AOMSI Indore.
Okay.
And also I practiced with Dr. Amit Porwal for 3-4 months.
Okay.
So
What all did you do there?
basically, so I did hair transplant with him, and other things which we did in our post-graduation study. They're not basically I practiced it. I know about this PRP, GCF, Botox, fillers, thread lifts,
Right.
and all these things.
Okay.
Okay. Okay. Any challenges? Acha, you said already that you think it's a tier 3 city, so you're a little skeptical about it.
I think
Okay.
the biggest
Mhm.
challenge is 10 lakhs revenue, man. That's the
That's
biggest.
a goal.
कोई
That's a
है
goal.
नहीं, कोई है नहीं. If I will start, then
Definitely.
obviously I think
You'll
You have the
upper
first
hand.
advantage.
Yes.
Yeah, you have the first advantage. So that is always
Definitely.
good to have. But remember one thing: pioneers always have arrows on their backs.
yeah.
Okay, so that's something to know.
Hmm.
Okay, so be ready for that as well.
Yeah.
Okay.
All right,
Ishita.
Dr. Ishita. If your network is off a little bit, I think you can switch off your video. Just keep your audio on so we can hear you clearly.
Okay.
Yeah.
Hi, I'm Dr. Ishita Chandrana from Vadodara, Gujarat. I had been passed out my BDS in 2020. Since then, 2 years I was practicing general dentistry along with one of my professors.
Mm-hmm.
But since the market in Vadodara, in every building there is a dental clinic. Some buildings there are 2 dental clinics. So the competition there for the dentist is like really, really difficult for a fresher to start with.
Right.
Yeah, so I was in one of my cousins in dermat, so she suggested me that I can go for this field as well, being a dentist.
Right.
So I did some diplomas in cosmetology and trichology in Mumbai itself.
Mm-hmm.
But my main concern was that I didn't got much hands-on for Botox and fillers and all such things. I mean, these treatments are like a tricky and fairlips and all. So
Right.
I was searching for some institute which can provide me much hands-on in these topics particularly.
Right.
So I found yours, so I came here. Actually, I myself have undergone some treatments for my face, like MRIs. So I got really good results, and so I was like, even I should start with this.
Right. Good. You have first-hand experience. That's good.
And yeah, I got good experience on my face itself. So I was like, I can do good to others as well.
Right.
And here in the market, like for MNRs, at least I know people are charging 5,000 to 10,000 per sitting. So it's a good market, I think.
Yeah.
Do you plan to open your clinic, Ishita?
Yes, definitely. I want to open my own clinic. Actually, I'm not there exactly, but yes, wherever I get married, I'll definitely open my own clinic there in that city.
Okay.
Are you already
My
like?
plans are
Sorry. I was
Yeah,
asking.
my plans are to open my clinic in Gujarat itself.
Okay. Any particular city? I mean, if your marriage plans are finalized, do you know the city where you're going to practice?
No,
It'll help.
the plans are not yet finalized, so I'm not sure whether I get married. But definitely, I want to do it in Gujarat itself.
Okay. Okay,
Okay.
that's good to know. So for now, it's going to be Vadodara.
Yes, for now it is in Vadodara.
All right.
Okay. Do we
There are
have?
not much cosmetic clinics in Vadodara, so I think it will be a good start
It's a
there.
good. It's a good place.
It's
It's a good
a
market.
lovely market. Vadodara
It's
is
a
a
booming
good market.
market.
Yeah, Vadodara is a good market.
Yes.
What are the challenges that you see, Dr. Ishita? I want to know.
Challenges, I don't know in the field of aesthetics much, but yes, being a dentist, there are many challenges. As I said, there are so many dental clinics, like every building has a dental clinic. So it is becoming very difficult for the freshers to earn good in general dentistry. So
Right.
I wanted to add something to it. So I think aesthetics it will give me a good add-on.
Right. Right. No, I mean, as in I was talking about in starting out with aesthetics. I mean, you've done programs as well, so I am sure that there must be a reason and certain challenges that you might have already faced that has sort of held you back and not allowed you to start your practice completely. So I would want to know a little bit about those challenges, especially you. I mean, with others,
Yes,
for them it's more so imagined challenges, but I think in your case you would have already faced some of the challenges, I think.
yeah, actually, the main challenge was not for the market competition. The challenge was from my hands-on. I mean, I was not sure with the some treatments that I learned there, like as I said, Botox, fillers, and fillers. I
Right.
did not got much hands-on, so I was not confident practicing those treatments. Whereas non-invasive treatments, I was quite confident practicing it.
Right.
I wanted to join some institute which can give me a good practice in these topics
Right.
specifically.
Right. Okay.
Okay.
Because these injectable things are like, if you're not confident, I don't think I can spoil someone's face. That's why I wanted to do some more
It's a good
practice.
thought.
I wanted to learn a better way.
Yes, that's perfectly. I think that's a good thought to have. Yes.
Definitely. Um, Ishita, what are your money targets? What do they look like?
At least 4 to 5 lakhs a month, because I have seen people earning this much at least even in the starting of their practicing, even in the starting 2 3 years, they are earning this much. So I'm expecting 4 to 5 lakhs at least.
Right.
Okay.
Okay.
Good to know. Good to know, Ishita.
That's good to know.
Do we
Yes.
have Dr. Anil here?
Dr. Anil, no, he came in, but he's dropping off again and again. I have a feeling he's unable to join.
Okay.
Do you want me to take an update from him? Maybe on a phone call? I could do that.
Or else we'll just drop
No,
him
no,
a message.
I'll just give him a call because I think he was trying to join in. I'll just see if he's got some technical issues or something.
Okay.
Just 1 second. Muted here. Okay, then you can switch it on once I'm having on.
We'll start.
Yeah.
Okay. So an important thing for all of you to know that is that before we start with the learning of cosmetology, I want you all to open up your minds and your eyes. Okay, because what all we think ना कि cosmetology सीखना है, hands on करना ज़रूरी है, of course बहुत ज़रूरी है, as Dr. Ishita mentioned that till the time you don't have enough confidence, you cannot inject the patient, right? So that confidence is very very important. But वो confidence आने के लिए there are multiple steps. Okay, it will not just come with the hands on. There are a lot of things which goes before that. सबसे पहले anatomy. You have to know the anatomy. Till the time you don't know about the muscles, you don't know about the facial layers, you don't know about the skin, you don't know about the blood supply, the nerve supply, you won't get that confidence of injecting. Even if you know the hands-on bit, if you don't know the muscle exactly, or if you don't know the blood vessel exactly, that confidence won't come. So learning that is very important even before you hold your syringe. Okay, I'll be covering the basic anatomy in the next session as well. I have shared a little bit of introductory document with you all, not too much because you guys are not going to read that much, I know. So I have just given a beginner's guide for you all Once you finish your program, you are going to get tons of study material, because even when I have taught you everything, your duty and your responsibility is to go back and read it completely from the books that has been provided to you. The books are all international. They are very very highly reputed books. मतलब इतना content है कि आप लोग 3-4 साल भी पढ़ोगे तो वो content खत्म नहीं होगा about the cosmetology. That much content you all will be getting. But I'm not giving you right now because कुछ समझेगा नहीं. Even if I give you the books, you guys will not understand that. So I am going to take you through everything, and then your responsibility will be to study it at the core level, to understand each and everything specifically. So that is point number 1. Your knowledge has to be very very good. You cannot just blindly go on patients. So your knowledge has to be very very good about the anatomy. Second important thing that you have to know. Now why I am insisting on all these things is because when you come here, when you guys do the hands-on on the patient, what you also have to keep in mind are the background factors that I am telling you about. All these will go parallel to each other. One is not secluded from other. Okay? So second important thing that you guys need to be aware of is the facial concerns, or what all you see on the patient's face. You have to know that. आपको देख के पता चलना चाहिए कि what is it about. Any updates, Dr. Anil ka? Jay?
Yeah, he's in ICU treating some critical patients.
Okay. So I'll continue.
Yeah, please.
So the next thing that you guys need to know about the facial concerns. Now how in dentistry, once you see a teeth, now central incisor, you exactly know what is wrong with the central incisor. Edge टूटा है, बाहर है, अंदर है, more overjet, overbite is more. You just see it and you know it. You don't take time to think, right? That's how when the patient sits in front of you and tells you that, okay, you know what, I have some issue with my central incisor, you exactly know what the issue is when it's clinical. Same you have to know about face. So you have to know about all the facial concerns from A to Z. Looking at the face, we don't know because we have not studied that in our curriculum, right? We don't know what is ideal. So when we don't know what is ideal, how are we going to treat something which is non-ideal and bring it to ideal? Right? Like how we know that how the normal tooth anatomy is. We have practiced it, we have carved it. That's how we know what is normal. That's when we do the filling, we exactly know what curve we want to give it to. The same you have to know about face. Because by the time patient comes, sits in front of you and tells you their concern, that's the only time you have to look at the patient, to figure out the concerns, the problems, the treatment plan, for the diagnosis, the treatment plan, the money factors that you will incorporate with the treatment plan and present it to patient. Right? So you are not going to get more than 2-3 minutes for that. So you have to be very quick and thorough with the facial examination. Okay? Not every time patient is going to come and tell you कि मुझे यहाँ Botox चाहिए. They'll not tell you. Sometimes they'll tell you, there's something wrong, I'm not able to figure out, but I want to look good. There's something which bothers me, or I have some concern. But then it's not always going to be clear cut, and you will see that when the patient comes here, you are going to make the plans yourself. But the primary thing before that, before doing the procedure, comes the facial evaluation. Again, we are going to learn that thoroughly. Okay? So I have an activity for this particular thing which I am going to send as soon as we end this session. I am going to send you an activity where you have to evaluate 3 random faces. Pick up any face, your friend, relative, any patient, anyone you see in your area, and if you don't find any face, take a picture from Google. I'll exactly send you what kind of profile I want. I want a front profile. And you will examine that face. You will tell me what is wrong in that face with your knowledge, with your current knowledge. You guys have to tell me what is wrong in the face, and we are going to take you from there. Okay, till the time you are able to properly evaluate all those 3 cases thoroughly and make a treatment plan for them, because there is a scope for improvement in each and every individual. Okay, so that is one activity that you are going to do, and of course we are going to be learning the face evaluation in the coming sessions as well, because that is the core, right? The next thing after face evaluation that is very very important is treatment planning, diagnosis. So once the evaluation is done, diagnosis is done, you have to plan the treatment. Now for you to plan the treatment, you have to know all the procedures which are there in cosmetology. तो जब आपको पता होगा कि ये बोटॉक्स है, ये फिलर है, बोटॉक्स इस चीज के लिए करते हैं, फिलर इस चीज के लिए करते हैं, then only you will be able to apply that on the face, right? That okay fine, this is the concern, I'll pick this procedure, this is the concern, I'll pick this procedure. So you have to know all the procedures so that you can plan a treatment accordingly. That again we are going to learn. Now once we are learning the procedures, once we are learning about a product or a procedure, the thing again which is very important before the hands-on is product selection. Now this session will go hand in hand with me and with Jay both, because now when we say product selection, so you guys have used dental materials, right? Everyone, we learned dental materials before we learn to do patients, isn't it? Before even we learn to do procedures on a dummy, we learn about dental materials. Why is that important? Because if you don't know what material will go, okay, what is the setting time, what is the preparation time, or what are the properties of the material, when can you use one filling material or when can you use other, in what condition you have to change your materials. Till the time you don't know that, you even if you know the hands-on, you can't properly apply it, right? So complete cosmetology industry is a product based and a device based industry. Everything is either a product or a device, and you have to know the core of it so that you can successfully give good results to your patients. Because even if you know a good hands-on but your product selection is wrong, the result is not going to be optimum. So the product selection becomes very, very important. And now because it's a completely product based industry, the important aspect is the pricing. Okay, what is the price at which you will pick up the product from the market, and what is the pricing you will charge the patient based on your area, which city you are in, which area you are based in, what does the competition look like, how will you set your pricing. All these things will be covered in the business session. So both goes hand in hand. So the good knowledge about products is equally important, right? Apart from, of course, as I said, hands-on. The next part which is very, very important before the treatment planning is patient consultation. Taking a proper case history of the patient, understanding the patient's concern, understanding what they are saying and formulating it into a treatment. Like they will say XYZ thing, how to formulate into a treatment plan is very, very important. And we are not going to be missing that part, because that again plays a very important role in the success of your treatment. The consultation part, how do you consult? Now see, the cosmetology patients are really different from any other medical field or dental field, right? Jay will tell you more about that, because this is a want based industry. I always mention this is a want based industry. Other medical fields and dental fields are need based. Patient comes with a need, a concern. This is a want. So the expectation mindset of the patient is very different, and dealing with them is a different scenario. You cannot deal them like you deal your regular dental and medical patients. Okay, so that also is an important aspect which we need to tap. And then comes the hands-on part. Again, very, very important. The core of cosmetology, one of the core of cosmetology is the hands-on part, where you need to exactly know that where you need to put products, where you not need to put, kahan touch karna hai, kahan nahi karna hai, kis area mein karne pe kya result aayega. You need to know everything about the hands-on aspect. So when we say one procedure, we are going to be covering all the things related to that, A to Z, everything. And this is patient aspect. But what is more important from this, apart from this, is how will you get that patient? Because even if you know the best of the procedures, even if you know the best of the products, you know the anatomy, you know the consultation and treatment planning, but you don't know how to market yourself and how to present yourself in the market and how to generate patients out of it, how to earn revenue out of it, it's all a waste. So it's a combination that you need to learn, right? I think Jay will tell more about the business aspects that he is going to cover.
I will. So as Dr. Sapna was saying, ki, you know, एक मेजर पार्ट होता है यू नो इन कॉस्मेटोलॉजी, जो ये फर्क जो है ये इट्स अ वांट बेस्ड इंडस्ट्री एंड नॉट अ नीड बेस्ड इंडस्ट्री. Fortunately Dr. Anil is not here, so this batch is full of women right now. So I'll ask the women, how many of you go to salons? Please give me a raise of your hand, or on the Google Meet raise hand wala button, just give me a raise of your hand. Okay, okay. Dr. Ishita doesn't go to this thing, huh?
She goes to a cosmetic clinic directly. You know, she has done cosmetic procedure.
Dr. Ishita, you don't go to a salon, is it?
I don't know. It was
यार बाल कटाने तो जाते ही होंगे ना आप, मतलब बाल तो कटाते ही हैं सब.
if we go a time the patient.
We can't clearly.
We can't hear you. Please, can you keep your video off? I think that will work better. Yeah. आपका नेटवर्क का कुछ इशू है.
I definitely go visit salon.
And I spend a lot in salons.
I was not able to survey.
Right. So now I want to understand. I mean, because see, if you understand why you go to a salon, and okay, I'll ask the next question. Okay, which is whatever salons you go to right now presently, how many of you want to upgrade to a better salon if you had an option?
None. They are very happy.
Acha, satisfied.
Anjali and Chamandeep, they both want to upgrade.
Okay, like let's say for example, I don't know, अगर आपके शहरों में you have like you know we have like you have Lakme, then you have Enrich, then you have you know in Mumbai में you have JCB, which is Jean-Claude Bleguin, which is a French brand. You know, so you've got upgrades and upgrades and upgrades, right? So if you got a chance to upgrade your salon or go to a better one, would you go? You would go, right? You would go, right?
Yes.
Yeah. So see, this is the difference, right? But let's say for example, if you had some toothache, okay, and let's say your husband's one, boyfriend's, or whoever else in your life was not a dentist, and you had to go to a dentist like a regular person has to go to a dentist. How many of you would want to go to you know जिसका एक 5-star clinic है versus जिसका clinic you know 20 साल से है, एक छोटा सा clinic है लेकिन 20 साल से है, patient की line रहती है वहाँ पे. How many of you would want to go there versus a 5-star clinic? You see, I don't need your answers. I already know the answer, okay? Because I know I study the markets. So I know the answer. But do tell.
The smaller one most probably.
Right. Yeah, so basically this is the major difference, okay? If you can understand this about your own mindsets, you will understand the patient's mindsets as well over here. Right? This is very important to know. Why will any patient, okay, and we are calling them patients because this is a medical setting, and it is a medical setting, but you have to understand from a patient's perspective, they don't want the medical setting in their mind. They have a beauty or looking good mindset, you know, when they are coming to you for any cosmetic concern. Most of the cases, okay, I'm not talking about scar revision hai ya matlab, you know, ek major kuch you know damage hai which they want to undo, or you know they have a birth defect that they want to undo. I'm not talking about those cases. I'm talking about 90 to 95% of the patients that are going to come to you. Okay, I'm talking about those patients. Those patients are thinking about beauty. They're thinking about looking good. Like the hair transplant. Hair transplant में 90% patients are male. Why? Because आदमियों के पास में सिर्फ एक ही चीज होती है, बाल. Right? अगर वो नहीं है तो फिर मतलब आदमी की confidence की धज्जियां उड़ जाती हैं. Right? Where same thing for a woman. If a woman has not put on makeup and has to go for a wedding, I don't think, I mean, please correct me if I'm wrong, but I think जहाँ तक none of you would go to a wedding not wearing makeup, right? None of you would go. You would wear at least lipstick तो लगा लोगे आप, मतलब कुछ नहीं तो at least, if not anything else, right? So that is the primary thought process of your patients as well. They want to look good at the end of the day. So when that is the mindset, and that is why you know I was pointing out to you as well, where you know you said कि onco का पूरा hospital है, and you know you want to set up over there. I said I would like to change your mind on that, because patient doesn't want to come think of it as a medical thing. They want to think of it as a beauty thing. They want an experience.
They want a luxurious,
They want to feel good.
yeah, luxurious experience.
You know, so they want to feel good at the end of the day. And after feeling good, वो एक experience की बात हो गई. उसके बाद they want to take home and they want to be told by other people that they are looking good. Just like when you get a good haircut at a good salon, you know, and people say, oh wow, I like your hair. So everybody likes it, right? That's what they want to also feel. So knowing that is going to be an important part of our conversations, and I hope to inculcate those ideas and those that knowledge as to what patients are looking for and what they are going to pay for and what they are going to come to you for. I would hope to be able to incorporate that into your practices and into how you are going to conduct your practice as well. Okay. Um, Please bear in mind that this is completely we are going to be doing it. It's completely ethical. It's not going to be like, you know, how some to give you an example in the medical field, how some gynacs will zabardasti they will get C-sections done just because they can earn more money. It's not going to be like that. Okay, that's a big no-no. Something that Dr. Sapna is you will hear it from her. So I'm not going to say it, but it's something that we take very seriously, that we do not force feed the patient or try to convince the patient to do a procedure. That's not how that works. Okay, but it's going to be how to find the right patient that they'll come to you. You know, that's something that I'm going to be incorporating. कि because सबको अच्छा दिखना होता है. You know, everybody wants to look good. There are only a few factors that are stopping them from going to a clinic and all of that. So we are going to be talking a little bit more detailed, especially in the marketing sessions. We are going to be talking about how that works, how does the mindset work, how does the psychology of the patient work when it comes to cosmetology. As she said, again, product side is something that is very, very important, because it's going to decide. It's so deeply, tightly integrated with the practice, क्योंकि आपके जो पेशेंट आएंगे उनकी पेइंग कैपेसिटी पे डिपेंड करेगा कि आप कौन सा प्रोडक्ट यूज कर रहे हो. दैट इज गोइंग टू बी वन पॉइंट. सेकंड, what kind of result, how long lasting result does your patient want, and how good a result does your patient want. So all of these factors, again, yahan pe patients wants are the guiding light for you guys, and that's going to be how we are going to decide which product to use, what products first of all exist, and unme kya differences hain. From a medical aspect, Dr. Sapna will be explaining from a price point and how you fit a particular product and how does that calculate into your revenues and your expenses, is what I'm going to be discussing with you during the course of these sessions, right? So that's also something that I'll be talking to you guys about, right? All right. So Dr. Sapna's activity, please, she's going to be doing it. She's going to be putting it in the group. So please take serious note of that. As she pointed out, face evaluation is going to be one of your primary learnings, okay? And the reason why, one of the reasons why we actually incorporate that into this thing is because that is going to be the part where you will either make it or break it. The face evaluation in your practice, that is going to be a major a point which is going to decide whether the patient is convinced or not. Okay, because that is where the patient will be just like for example, I will be like, okay, I have under eye hollowness or I have dark circles. They'll not even say under eye hollowness. They'll not even say that. They don't know what is under eye hollowness. They'll be like, मुझे dark circles. I have dark circles. Do something about that. I want to get rid of them because they really, look big, or they look ugly, or they make me look older, or whatever it may be. Right? They're just going to tell you that. Whether that is pigmentation, whether that is under eye hollowness or some other concern, that's going to be your job to figure out, right? So that, because that's going to again then tie it into what kind of treatment planning you do, and then that's going to tie into the product that you're going to be using, and the treatment modality, and what it's going to cost the patient, and what you're going to make out of it. So all of these things are going to be tied in like that. So that is why the face evaluation is such a primary aspect of the practice, right? So what we want to do with this activity by going in blind, what we are trying to figure out is where you are presently. It's information for both you and me together, and Dr. Sapna together, that where are you presently, and then where do we have to take you. We know where we have to take you, so we know what gaps we have to fill over those days, over those months, or over that time, so that you become great at evaluating the patients as well. So that's going to be one thing. I'm in my business sessions, I'm going to have business activities as well. Those are things that I expect you to do as well. Those are going to be very new for you guys. I take it lightly, and I understand that you guys are doctors and you have zero exposure to. Most of the doctors have zero exposure to the business aspect of the practice. So I am going to take it slow, and I'm going to take it, but I'll be giving you activities as well, all of you, to do business activities to do in your during the program, right? So that's going to be that. Yeah. So I think if you guys have any questions for us, just raise your hand and we will be able to answer them. If not, then we'll end the session. Any questions that we can answer for you guys? None? Okay. All right. So great seeing you guys.
Right. So guys, I'll just share the activity in few minutes in the group, and tomorrow we'll start the first part, the first topic about cosmetology, that is a little bit about facial evaluation, and to begin we'll start about aging and anti-aging, because till the time you don't know what aging is, what anti-aging is, we'll also learn a little bit about the muscles, about the bones, basic anatomy, all those basic things we are going to cover tomorrow. Please be present because it's going to be an important session. Don't miss it. In case you miss, we'll provide you with the recordings, but I would want you all to attend so that if you have any doubts, you guys can ask me. And before that, you have the entire day to finish the activity that will be given to you. So kindly do that. Don't skip the activity because it is going to be quite helpful for you all. You will be able to see improvement in yourself in the coming days once you have kept a track record for that. So see you soon tomorrow. Bye bye.
Bye
Good
guys.
night.
Good night.
Bye bye. Good night.
Bye. Good night.
Bye bye.
Ciao.
वो एक्टिविटी के लिए वो फोटो नहीं है मेरे फोन पे.